So it is Thursday. It is now 2 weeks and 4 days post-surgery. And I am feeling loads better, which is fabulous. I have begun to introduce some new foods into my repertoire. So far I have added yogurt and a turkey burger. Now, mind you, not an entire turkey burger, half of a turkey burger, and then a quarter of a turkey burger. Actually, that made 0 sense. I've a quarter of a turkey burger I was able to eat last night, and I just had a quarter of a turkey burger a few moments ago. So the trick that I was told, which I'm doing with food that I actually have to chew, is to cut it up into pieces that like you'd give to a baby or a toddler. So that's what I'm doing to make that whole process easier. I have also successfully eaten a pudding cup twice in its entirety in one sitting. And I am finding it easier to get all my fluids in. Or the fluids that I need to right now. I haven't graduated to the full-on 64 ounces of beverage yet, but that's okay. My doctor told me it's fine. So I've done that. I've managed to have a couple full popsicles in one sitting. Getting better with the protein shake, although it's still not easy and takes me a good part of the day to finish one. But that's happening. So I'm making progress. My hair, which you can see is a disaster, is pulled behind me because that's the only way I can deal with it right now. I am seeing my hairdresser tomorrow, and she informed me that because of anesthesia, 6 weeks after anesthesia, your hair really starts to fall out. And then she said, on top of that, 'tis the season where you lose about 100 to 150 hairs a day in general anyway, and that I'm going to expect that to double. So she recommended Rogaine, which kind of freaked me out a little. And I was like, well, she's seen this before in her people, right? But my husband was a little concerned because Rogaine is a medication. And I did a little research and I was like, So I contacted my doctor today and he said to me, don't do Rogaine. So I'm going to take my doctor right now over my hairdresser because, medical professional. But as I shared with a couple of my friends, if I go bald, then remind me that I should have listened to my hairdresser over my doctor. My doctor said that the hair loss should only be about 3 to 4 months. And the hair loss is associated with the rapid weight loss. And that's what happens. I am taking biotin, which is supposed to help on a daily basis. I'm taking my multivitamin on a daily basis. And I was just told that I can start using collagen. And so I was just recommended a new collagen to try. So I'm going to do that. And then hopefully that will start helping with my hair, which is a disaster right now. So the next time I record, I will probably have a different hairstyle because it was strongly advised that I let her cut it. And although I've been very happy with having long hair during this pandemic, I think based on what's going on with my hair, I'm going to have to listen. So it's coming off. Not all of it, but it's coming off. So that's something to look forward to. Let's be honest about something right now, which people probably don't like to talk about, but I'm going to because that's what this is, right? So I apologize in advance if this makes you uncomfortable, but let's talk about bowel movements. They have been difficult since the surgery, and I happen to be struggling with that for a little bit. And the doctors basically tell you should go every 3 days. And if you don't go every 3 days, they want you to take something to help you. So at one point, probably last week, I attempted milk of magnesia. Now in the olden days, if I had to take milk of magnesia, which was very rare, I could it's shot glass it, it was done, it was over with. But because I can't drink that way anymore, I had to sip it, and it made me sick. So I asked him what he would recommend to help with this, and my doctor, and he said Miralax. So on my to-do list was Miralax, but Mazel Tov, I've had bowel movements yesterday and today, so I feel accomplished, and I feel like, well, maybe I'm over that hurdle because I'm introducing food, and maybe the bowel movement thing will be okay. So just so you know, that's a thing that can happen here. So it's, you know, it's part of it, and it's not a pretty part, but it's part of it. What else can I share with you this week? I still can't breathe when I walk upstairs, but I have energy, surprisingly, for so little nourishment, and I am comfortable again, and my scars are healing. And so, you know, as bad as it was for when it was bad and when I was recording that it was bad, I do feel like I'm over that portion of it. I will see him and my doctor in a few weeks, and hopefully get cleared for some more information, cleared for some more activities to help strengthen specifically my lungs so that I can start breathing properly again, because it's really unnerving to not be able to breathe when I walk upstairs. And I live in a townhouse. I have a lot of stairs, so that's a problem. But I have started to walk a little bit, not a lot, not anything like I did pre-pandemic, but I have started to do that, so that's a good thing. And while it still irritates me that my family is bringing food in the house, and sometimes I end up cleaning up after them because they leave it out, I don't have any desire to eat it. So that's good. Not that I could anyway, but I don't have a desire. And now the dogs are barking. So this is another long video explaining this part of my journey. And again, I am however many weeks post-surgery, or however many days post-surgery, and I'm moving forward, and I'm smiling again, and I'm laughing again, and I'm communicating with people again, and I'm not as angry anymore as I was. So all good things at this point in time, and just still learning how to eat in this new body of mine. So that's the fun stuff right now. Thanks for listening.